Good afternoon and welcome to Can Cable 21. My name is Lucy Aquino and I'm the Chief Executive Officer of Hispanocare Inc., a program of Advocate Illinois Masonic Medical Center. And today we're going to be discussing normal adolescent depression for the next 25 minutes. Please, if you have any questions, give us a call. The number's at the bottom of your screen at area code 312-738-1060. Again, that number is 738-1060. The number's at the bottom of your screen. The lines are now open. Joining me today is clinical psychologist Joanne May, affiliated with Advocate Illinois Masonic Medical Center with the Department of Behavioral Health Services. Please allow me to welcome you on the show. Thank you for being with us today.
Thank you, Lucy.
Well, very important topic. I know, Dr. May, that depression may have a slightly different set of symptoms for children or teens, and children and adolescents may be more likely to have symptoms like unexplained aches and pains and irritable or social withdrawal. But we also know that there are many different moments for parents during these times for these teens and children. So, Dr. May, that's why we're here today to talk about such an important thing, and it's awkward at times for children at different ages, and I know that's something that we need to discuss because as parents or new parents experiencing these kind of changes could be alarming to some and not alarming to others. So what do you say?
Well, first, thanks for inviting me here this afternoon.
Thank you.
And I'm so excited to actually be here to talk about normal adolescent depression. There are many, many difficult moments for parents, particularly in that decade, adolescence. Mm-hmm. And today, I'm just going to talk about what depression looks like in your teenager. So an adolescent's tantrum actually might look like a roll of their eyes, storming out, or saying something like, "You're the worst mom or dad in the world," slamming of doors. And sometimes parents find these tantrums harder to bounce back from than toddler tantrums, because when a toddler has a tantrum, you don't feel it in the same personal way. With a 2-year-old, you could kind of forgive the fact that they were hungry, and a banana and a nap do a lot to help cure and make things better. And they'll eventually stop screaming. Mm-hmm. But older kids' tantrums hurt the feelings of their parents often, and so sometimes it's hard to know how to proceed.
Right. So how can parents think about these moments so that they are not so hurtful?
Well, the first thing, and it's really important, is that parents need to think about the meltdown doesn't come from out of nowhere. Adolescents actually have lots of stressors. They have to do with peers. It has to do with school, social pressure. And so there's a lot on their mind. And it might be a small consolation, but oftentimes teenagers have a meltdown in the presence of people that they feel like they can trust. They can actually show you how difficult things are and how they're really feeling. But in those very hot moments, it is important not to escalate the difficult moment. Your job as a parent, a good parent, is to move through the mood, taking a hot moment and making it a cool moment. Right. So the parenting skills that actually worked during childhood, which is where we learn to tell a kid what to do and expect that we can actually make that happen, it's very different in adolescence, where the skills that a parent needs are negotiation and an affinity and enthusiasm for shared decision making. And this is sometimes a tough shift actually for parents, particularly those of us who didn't have our own parents who may have thought about negotiation as the strategy that they used to raise us. And unfortunately, unless we actually think it through carefully, sometimes parents are prone to repeating the mistakes of our parents as much as we would want to think differently.
Yeah, and many times we do say that, I'm not going to be my mom or dad. I am not going to be the same kind of parent.
Right, exactly.
So should a parent tell the teenager what we are thinking and feeling?
you don't have to do it in the moment. When it's a little kid, it is helpful to deal with it in the moment. But with a teenager, if you are really upset, it is really fine. Use the plural pronoun we and say something in a low volume, soft, slow paced voice. Something like, we're both feeling awkward or angry right now. Could we talk about it later? Sometimes using an interrogative where you end a sentence in a question, we could say to a teenager, leave, or we'll talk about this later, but it actually sets the stage for negotiation and shared decision making if one says, do you think we could talk about this later? And then you talk about it when you're both in a better frame of mind.
But what do you do in a situation when a child refuses to take that in a better frame of mind? So what is a parent to do?
Well, a parent always has the option to take the high road. And so if one, for example, said to a teenager, make your bed, and the teenager says no, one choice is to try to physically engage the child to complete your command, but you don't want to base a relationship with a teenager on fear. It's much better to base it on love. And so sometimes just saying, okay, I'll come back later, and then we're going to talk this out and see what's next.
Right. So, Dr. May, I've heard that the adolescent brain is not fully developed, and when does the adolescent brain really develop?
Well, this sometimes helps parents actually get through adolescence by remembering that the area responsible for emotional and impulsive responses and keeping those in check are still reaching maturity during adolescence and often aren't fully developed until 23 to 25. So you may have thought you only signed up for it through 18, but such is not really the fact.
How?
And the fact that the brain develops this slowly provides clues to the youthful appetite for novelty and a tendency to act on impulse, often without regard for risk.
Wow. So this could be quite a frightening thing for parents and could be part of, it's part of growing up and more times than we ever expected, as you mentioned, to have, to remain in that parenting role. I mean, sometimes things do get out of hand and it's trying to come back to that and just hanging in there and remembering that you are a parent and you have a role to play here.
Well, the job of every adolescent is to do his or her level best to not let on that you're doing a good job as a parent.
Right.
And getting through adolescence sometimes includes an element of luck and an incredible amount of monitoring that teenagers hate. But the real deal is that God put parents on this earth because someone needs to watch them carefully, because they are often, excuse the phrase, one brick short of a full load. And I often tell parents that it is worth getting through well this adolescent period because you don't really know what a kid is going to look like or turn out like until they're about 25. So doing one's best to watch and be prayerful, but watch and know where your kids are, know what they're doing, talking as often as you can. We always say in a moment, particularly of crisis, the wrong thing to do is to freeze the other person out. The thing that's really effective is to increase your communication in a crisis. And the more families talk, the more likely you're going to be able to get an adolescent through this period unscathed.
Right, right. So what does depression look like? I mean, when it's more than just normal teenage stuff and things that teenagers go through, what are the difference between adolescent males and females, especially because they are totally different?
Sure. And it's interesting because children, the incidence of depression in children is about 3 to 5% until they begin to get into puberty when it stays at about 3 to 5% for boys, but it goes to 14 to 20% for girls. So big gender gulf.
Doctor, we have a caller on the line.
Hi, I wanted to ask if a child or an adolescent is showing signs of, or at least a parent thinks maybe showing signs of depression, or maybe even possible something like suicide or something like that. Do you recommend, if the child's not talking to you, if you're asking them questions, do you recommend looking through their things in their room and things like that, or what would be an alternative?
We'll answer that for you, caller. Thank you.
What a great concern, actually, that many parents have. And I think it depends on the age of the child. One should never give up trying to talk. And the kinds of questions we ask should be, instead of saying, how did your day go today? And a kid could say, fine. An open-ended question with, what was the best and the worst thing that happened today? And just waiting in the hopes that there'll be some conversation. And if there isn't any, continuing to do that for 100, 200, 300 times, because it's a signal to the child how much you care about what's going on with them. And deep down, kids might on the surface show that they are not interested in conversation, but deep down they really notice, and it makes them feel better to know that somebody is watching, even if they're not on the best behavior. With regard to going through things, I think for a younger teenager, yes, that he who pays the mortgage rules, that you should know what's in the drawers, what is under the mattresses, and that it can be part of regular cleaning, and is just an expectation that parents have the right to know just about everything about their younger teenagers. If you're talking about a teen who's 18, 19, then I think there's more negotiation about what's in the rooms, although you might want to make sure that your teenager knows what cannot be in the room. Pot, alcohol, uneaten food, and that should, in the course of cleaning or any other day-to-day activities, forbidden things be in the room, that we would talk and that there would be consequences, because parents hold the cards with regard to consequences, and kids, until they are wiser, need to actually obey whatever the limits are that parents set. I think the most important thing about this caller's question is kids change every day, every season, every week, and I wouldn't go to too much of intrusive strategies without also keeping the communication strategies as part of your every single day routine, and do it with a smile, with a sense of hopefulness. And tell a kid often and early, I love you, you're the most important thing in my life, and we can get through anything together.
That's a great response. And caller, I hope that response was helpful to you. And if you have any other questions, please feel free to call us back. So we were talking about the differences in genders. Male versus female, boys and girls, and what's normal? I mean, what's really normal?
Well, I want to tell the viewers that actually girls mature in terms of their emotional intelligence a bit faster than boys. And this sensitivity, increased emotional sensitivity, probably makes them more vulnerable to mood disorders, which could be depression and could be anxiety. And perhaps the reason for this is some kind of evolutionary advantage, because if you think about it, girls might be wired to tune into emotional stimuli because it was advantageous for nurturing babies. And young men, given their roles as hunters and tribe protectors, emotional responsiveness might not have been an important attribute to have.
Okay, so, but why is such a big disparity between the genders?
Well, we do think that the brains are wired a little bit differently.
Okay.
It's interesting because women have so many of the same opportunities as men
Right.
these days, and
Right.
sometimes we think about wanting to say everything is equal.
Right.
But as I said, actually, girls tend to mature with regard to emotional intelligence a bit earlier. So boys tend to be a little bit more immature, more impulsive, and girls tend to be vulnerable to anxiety and depression in those teenage years at a far greater rate than your sons will be.
So that being said, and knowing the differences in what parents should be looking for, I think really it's really important that we know what some of the signs and symptoms are for depression amongst our teens and adolescents. Can we talk a little bit about that?
Yeah. So the symptoms that people first usually see in terms of depression in a teenager is withdrawal, or when the teenager stops doing things he usually likes to do. There could be changes in mood, including sadness, sometimes irritability. Sometimes it looks like anger or irritability, but really what's right underneath it is depression. It could be a change in appetite, energy levels, sleep patterns, or academic performance. So we tend to get worried, really worried about how a child is doing if several of these symptoms are present at the same time, because it might indicate the presence of depression. And it's important that members of the family and friends actually be watching out for these things, because by the time a family member really notices the lack of interest in most things, a teenager, particularly one who's not talking about what's really going on with him or her, could have been depressed for some time. So depression is what we call an internalizing condition, and this means that it is a change in your internal emotional state. It's sometimes a lot easier to nab and identify kids who have externalizing behaviors like alcohol abuse or anger management problems, because you pick it up right away. But for children who are depressed, it's sometimes elusive and not really so clear. And when that happens, a child could have been depressed for quite a long time before family members realize that there is a difference in the thinking and her emotional responses. And the teenager, him or herself, it might also take them quite a long time to realize that something's wrong.
So I think it's always good, even for when you look at the family dynamics, and if you have a larger family, go to one of the other brothers or sisters, or a mom or grandma or grandpa, whoever's in the house, and ask. Maybe as a parent, as a mom or dad, you notice that something's different, something's off, not quite right. It'll be worth going to one of those other individuals who live in the household and say, have you noticed anything different about David?
Right.
Or something to that effect. And try to find out if somebody else is noticing something and it's not just you. Because usually parents' instincts are usually right.
Right. And always loop in the teenager.
Right.
How are you doing? Are you doing as well as you did last year? Has anything changed? What's on your mind?
Right. All important questions, and that's one way of getting them to talk to you. So parents sometimes are concerned, not sometimes, but often, especially in today's day in society and the number of changes that are taking place, there's concern about suicidal thinking and about substance abuse. How are these conditions related to depression, Doctor?
Well, there are 2 points I'm going to make with regard to that important question, because it is the fact that mood disorders can often run in families. And the factors that produce a trait or condition can be genetic, or it can be environmental. So if a mom is going to pass on a genetic trait, it's usually going to be to the daughter, and in turn from the father to the son. If the father has depression, it may more likely go to the son. And it's helpful for kids to know what disorders are actually traveling in their family so that they don't feel so alone. And just make it out in the open and talk about it. Kids should know what the background, what lurks, what are the shadows that have followed various family members.
Right.
So life events and stressors can also exaggerate sadness and depression in kids. With regard to suicide, sometimes there have been very significant depressions and or suicides in the family. And the more that kids know, and parents aren't hiding this, if there is substance abuse in the family, if they know that, and people can have some candid conversations about why binge drinking, particularly in this family, might be particularly dangerous. Of course, if kids are trying to hide their depression from their parents and friends, then we want to be alert to the kinds of signs that might be going on. Kids are not always forthcoming about how they're feeling. And with regard to suicide, just asking a child, particularly if there's been a suicide among a friend. Kids have this black and white thinking sometimes, like the only way to solve a problem is X. It's one of the things that is a problem about adolescents is that they don't think of lots of different options and alternatives. So if there is a close friend who committed suicide or an uncle who committed suicide, sometimes a child's immature brain will go too early towards that as a solution. And so if there has been any evidence already harbinger of a serious disorder or trauma in the environment, then having a family meeting, over dinner, over a meal, just talking, not once, but 10, 15, 20 times over time. These topics are never old.
Well, it's almost like sitting down with, many times I know when we speak to younger individuals in communities or out there, sometimes I just tend to ask little questions such as, so do you know, because I deal a lot with the other part of it, with, the diabetes and the heart disease and all those things. So we ask questions. So do you know your family health history? Your mom, your dad, your grandma? And most of them say, well, I think my grandmother has diabetes, or I think my grandfather died of a heart attack, but they're not sure. And this same topic can fall right into the rest of this, where parents can actually sit down and let's have that discussion about family health and who's what, mom's side, dad's side, and cover the depression part of it. Throw in there, if there's someone has committed suicide in the past. It makes it parts of that.
It does. And the other important thing besides genetics that actually can cause depression, anxiety, and other mood disorders in teens or anyone is a stressful environment, or actually seeing poor coping strategies in parents or friends or other family members. So if the parents are using weed, it's really hard to discourage teenage alcohol use or to talk about using better coping skills if what the kids are seeing is parents fighting instead of using their words to resolve conflict. There are a lot of things that can cause depression that have to do with what kids see in terms of family dynamics and what makes them sad or confused.
Well, you see your parents smoking and using marijuana or doing drugs, and then they're telling you, don't you ever do this, don't you ever touch this. You hear it and see it all the time. You can't expect a child to do what you're telling them not to do when they're looking at their parents and they're doing it. It's really, really hard. So substance abuse in teenagers, that's really huge right now. Something that we're all worried about. Dr. May, what can you say about that?
It is everywhere. Kids in late elementary and throughout high school are exposed. So parents who are great detectives know where their kids are at all times. I mean that, at all times. They check in with the parents who are sponsoring parties and know that those parents are both responsible and at home. There are too many parents who actually serve kids liquor, so you need to actually know the parents. And if your kids complain about how intrusive or you ask too many questions, the parent just has an opportunity to smile sweetly and say, you're the most important thing in my life, and that's why I need to know everything.
Absolutely.
And you can continue to know that I'm on it.
Right, absolutely. Dr. May, I want to thank you so much for being on the show today. And there are so many other questions that I wanted to ask so that we can share with our viewers such important information. So I take this opportunity to invite you back so that we can pick up maybe where we left off or another whole new topic, who knows. But this is such great information. Thank you so much. So for our viewers, if you need to see someone or if you have a concern about your child, obviously there's a lot of help up there. Seek it, find it. And if you wanted to reach our department over at Illinois Masonic Hospital Behavioral Health, you can reach them by calling 773-296-3220. Again, that is 773-296-3220. Our behavioral health department's at Advocate, Illinois Masonic Medical Center. So on that note, remember that you're not alone, that there are ways that you can feel better. And if you're feeling sad, hopeless, or irritable for what seems like such a long time, you might have depression. Please seek help. You're not alone. Remember that. On behalf of my colleagues at Hispanocare Advocate, Illinois Masonic Medical Center, and Dr. May, thank you so much for being on the show today.
Thanks, Lucy,
Really do
for
appreciate
inviting
it.
me.
So stay tuned for more information coming your way on CAN Cable 21. Thank you.